Good morning. My name is Michael Sokoloff. I am the CEO of Coronavirus Music Therapy. I am a board-certified music therapist, an MTBC. My MTBC number is 15458. And I also have a master's degree in nonprofit administration. So I am recording a series of lectures, and this is the YouTube version of a lecture which I've entitled Music Therapy Takes Charge of the Big Four, Why Music Therapy Works Best for COVID-19 Patients. So this is going to be a series of lectures, and the title of the series of lectures is either going to be How to Music Therapy or How to Do Music Therapy. I've copyrighted both of those. I'm not sure which one I'm going to use, so for this one I'm going to group it under both of those titles. And what my goal is I wrote a white paper on this topic, and I'm going to do a YouTube reading of the paper. It is April 30th, 2020, and I'm going to do a YouTube reading of the paper. I'm also going to create a audiobook version of it, and creating content on topics related to music therapy. So this is the first in the series. So author note. Michael Sokoloff. I'm a graduate of the Department of Music Therapy at University of the Pacific. Michael Sokoloff, MTBC, MNA, is CEO of Coronavirus Music Therapy. I am a board-certified music therapist, number 15458, and Bay Area representative of the California Association of Music Therapy. Correspondence concerning this article should be addressed to Michael Sokoloff at 657 25th Avenue, San Francisco, California, 94121. You can contact me at Michael, M-I-C-H-A-E-L, at coronavirusmusictherapy.com. And I give written permission to use previously published text, test, or portions of tests, tables, or figures. The abstract. The following is a white paper detailing why music therapy is positioned to take charge in modern medicine's battle against coronavirus COVID-19. This white paper explains why of the big four rehabilitation therapies, physical therapy, occupational therapy, speech therapy, and music therapy works best for treating coronavirus COVID-19 patients, their families, and frontline healthcare workers. Okay, so the introduction. Note, this article contains the following abbreviations: MT for both music therapy and music therapist, PT for physical therapy and physical therapist, OT for occupational therapy and occupational therapist, ST for speech therapist and speech therapy, and RT for rehabilitation therapy and rehabilitation therapist. Of all the types of rehabilitation therapies, I define the big four as physical therapy, occupational therapy, speech therapy, and music therapy. These were the four most common rehabilitation therapies employed for patient treatment when I worked full-time on my music therapy internship in a skilled nursing facility in San Francisco. My goal in this white paper is to show why, of the big four rehabilitation therapies, music therapy works best to treat coronavirus COVID-19 patients, their families, and frontline healthcare workers. The big four of rehabilitation therapy, Chapter 1. If physical therapy, occupational therapy, speech therapy, and music therapy were considered quadruplets born of the same mother, Mrs. Rehab Therapy, it is easy to imagine physical therapy as being the eldest child, occupational therapy as the second-born, speech therapy as the third-born, and music therapy as the baby of the family. Physical therapy formed its first professional association in 1921. Occupational therapy became a profession in 1917. Speech therapy became a profession in 1926. And music therapy became a profession in 1944. Even though in this chronology the profession of occupational therapy is older than physical therapy has the largest U.S. market size of the big four, amounting for an estimated 53% of the U.S. market of the big four compared to 37% of the U.S. market for occupational therapy. So we'll keep physical therapy as the eldest child in our metaphor. Note, percentages of the U.S. market size of the big four are hypothetical due to a lack of specific data about the music therapy U.S. market size in 2020. The physical therapy U.S. market size in 2018 was $34.5 billion. The occupational therapy U.S. market size in 2020 was $24.3 billion. The speech language pathology U.S. market size in 2020 was $4.2 billion. And I am estimating that the music therapy U.S. market size in 2020 is $2 billion. There's a lack of data regarding music therapy's U.S. market size in 2020. For the sake of creating a pie chart, we will estimate music therapy's U.S. market size in 2020 to be about $2 billion. All right. And I have a pie chart that shows the big four of rehab therapies. Music therapy amounts to about 3.1% of the total. Speech language pathology amounts to about 6.5% of the total. Occupational therapy amounts to about 37.4% of the total, and physical therapy amounts to about 53.1% of the total. Note, music therapy U.S. market size is an estimate. Also, percentages of the U.S. market size of the Big Four are hypothetical due to a lack of data about the music therapy U.S. market size in 2020. Also, please note that there are 7 rehabilitation therapies total. In addition to the Big Four, there is also respiratory therapy, cognitive rehabilitation, and vocational rehabilitation. Even though respiratory therapy and vocational rehabilitation may be effectively used with COVID-19 patients, the goal of this white paper is to concentrate on the Big Four of rehabilitation therapies. Music therapy's clear advantage treating COVID-19 patients. This is Chapter 3. Music therapy has a clear advantage in treating COVID-19 patients among the Big Four rehab therapies. In scientific research studies, music therapy has been shown to provide individualized clinical benefits to patients in a wide variety of clinical domains. Board Certification Domains 2015 identifies 8 clinical domains for music therapy services. Number 1 is cognitive, number 2 is communicative, number 3 is emotional, number 4 is musical, number 5 is physiological, number 6 is psychosocial, number 7 is sensory motor, and number 8 is spiritual. This shows how wide a net of clinical domains music therapy covers. In my own private practice of music therapy, coronavirus music therapy, I specialize in working with COVID-19 patients, their families, and frontline healthcare workers. For these 3 target groups, scientific research has shown that music therapy can improve immune systems, can improve relaxation, and can improve sleep, both the quality of sleep and the quantity of sleep, and sleep induction. And in the terrible situation for where a COVID-19 patient is given a fatal diagnosis, music therapy can work as a hospice service to provide life review, family bonding, and family bereavement. Music therapy is a clinical profession that is suited to treat a wide variety of clinical domains. That means that music therapy is uniquely positioned to be able to provide services in the widest range of clinical domains to COVID-19 patients, their families, and to frontline healthcare workers of any of the Big Four rehabilitation services, which include physical therapy, occupational therapy, speech therapy, or music therapy. According to the American Music Therapy Association in What is Music Therapy? Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. For the clinical professions of physical therapy, occupational therapy, and speech therapy, all of these therapies work extremely well on accomplishing goals within one specific clinical domain. According to Stevenson, 2018, physical therapy works to improve movement dysfunction. Therapists work with patients to restore movement, strength, stability, and/or functional ability, and reduce pain via targeted exercise and a range of other treatment methods. Physical therapy can help a patient improve gross and fine motor skills. It accomplishes this work effectively and professionally. But as a clinical profession, it does not in itself have the ability to provide a COVID-19 patient and family with hospice services such as life review, family bonding, or family bereavement. It is too limited in scope, whereas music therapy can easily and naturally provide these hospice services. According to Stevenson 2018, occupational therapy focuses on restoring an individual's ability to perform necessary daily activities. This may mean working to improve fine motor skills, restore balance, or assist patients in learning how to increase their functional ability via use of adaptive equipment, among other potential treatment options. Part of occupational therapy is sometimes teaching patients how to use adaptive equipment. Per Fulton 2015, adaptive equipment refers to devices used to assist with completing activities of daily living. Bathing, dressing, grooming, toileting, and feeding are self-care activities that are included in the spectrum of activities of daily living, ADLs. These devices can range from the most James Bond-like electronic devices to something as simple as a piece of rope to pull a hatchback shut, or an old tennis ball with a hole in it to hold a pen to aid in writing. The strength of occupational therapy lies in treating one clinical domain professionally and effectively. Occupational therapy treats motor skills. Even occupational therapy's teaching the use of adaptive equipment generally refers to assisting with motor functions. Speech therapy's strength is also found in treating one clinical domain area, communication, professionally and efficiently. According to Stevenson 2018, speech therapy is a type of rehabilitation therapy used to address difficulties with speech, communication, and/or swallowing. Since swallowing is technically a motor skill, one could say that speech therapy treats two clinical domains, communications and motor skills. But its treatment of motor skills is very limited. In certain situations, music therapy's wide range of clinical domain treatments can sometimes be detrimental. Since music therapy can treat such a wide range of domains, there is the distinct possibility that a music therapist working with a patient might wander into treating clinical domains of the patient that are not initially identified as clinical domain areas of client needs and strengths based on the music therapy assessment. The antidote to this problem is to have the music therapist take time to review the client's clinical needs and strengths on a regular basis to make sure that all the clinical goals and objectives being set through music therapy interventions in the music therapy session are working on helping the client improve on individualized clinical goals in the proper clinical domains. And this is the end of part 1 of this lecture, and I will be continuing with part 2 presently.